Hi, and welcome to the OAA Sports Medicine Foundation Show. I'm Dr. Rob Palumbo from OAA Orthopedic Specialists. And today we have a special day. I wanted to talk about April. April is Youth Sports Safety Month, and it's sponsored by STOP. STOP is an organization that was created by the American Orthopedic Society of Sports Medicine and has since been taken up by the American Academy of Pediatrics, the American Medical Society of Sports Medicine, American College of Sports Medicine, and really it stands for Stop Trauma and Overuse, Sports Trauma and Overuse Prevention Program. And what it is, it's a public outreach program. It focuses on the importance of sports safety, specifically related to overuse and trauma injuries. The initiative is not only to raise awareness and provide education on reduction of injuries, but also to highlight how playing in sports can increase the feeling of well-being, feeling of team, being a good team player, and actually teach kids how to be good, healthy adults in the future. The CDC, which is the Center of Disease Control, has noted a 5-time increase. It's a 5-fold increase in the amount of youth injuries since 2000. And that is an epidemic that like no other. But almost as bad a statistic as that is, we're finding out that about 70% of our kids that are associated with youth sports by the time they're 13th stop playing. The reasons are many. One is they don't like to be in organized sports. The other is injuries. The other is dealing with the adults involved. But one of the other problems is that we find that specifically one of the problems that we're seeing is the injury rate in our youth and adolescent and adult overhand athletes. And with me today, I'm happy to have a good friend and colleague forever, Howie Knudson from St. Luke's Physical Therapy. He's one of the directors there, and one of the best shoulder and upper extremity guys that I've ever worked with. So thanks for coming on, man.
Thank you for having me here. It's a pleasure being on this. We've done some radio stuff in the past, and it's been a long time, so I'm happy to be here.
No, it's great. And what I wanted to bring you in for, because you and I have both shared a lot of patients over the years.
Oh, yeah.
And what's really the crux of what I wanted to bring you on is how many of our injuries that we see are probably preventable, and how many are used to overuse or poor training. And specifically, and we'll get into this a little bit, you know, now that it's baseball season, it's Little League season, but, you know, we're already seeing, now that baseball's a year-round, we're seeing that these injuries throughout the year.
Sure.
And even though we're talking about a month that's raising the awareness for youth injuries in general and youth trauma in general, I want to talk a little bit more specifically today, because of your expertise, on the overhead athlete. And you know, first of all, I mean, what's one of the most frustrating things? I mean, I can almost say what you're going to say, but what's the most frustrating thing that you see in the clinic of a particular athlete coming in that's an overhead athlete?
Well, I mean, I think that in general, one of the things that frustrates me the most is lack of education. You know, so parents, coaches, you know, just the general public, they don't know what they can do to prevent things. I have conversations with parents all the time. They often leave decision-making to coaches who may or may not have training. They may have played youth baseball or high school baseball, but you know, they're there as volunteer, and they're entrusting them to know some things that they might not even know. You know, so I mean, for me, I would rather prevent all of the injuries that I see, and instead of seeing anybody in the clinic, particularly, you know, 12, 13, 14, 15-year-olds. And
that's one of the reasons for the show. That's one of the reasons why you and I have been involved in conferences to coaches and parents. And I think that's almost the most important thing, because it's starting to get down to the level of we have to educate the parents, I think especially the moms, because people have to watch out for their own kids now.
Sure.
Because let's face it, when a coach sees a kid, their job is to feel that they need to make that kid as good as they can, and also to plug that kid into their team and make their team as good as that team could be.
Right.
And quite honestly, that carries through kind of every level of sports into professionals. That's the coach's job. Now, obviously, they'd like to prevent injuries and they'd like to prevent overuse problems. They'd like to keep up with the most modern views of training. But I think that's where we fail. I think that's where we fail. There's been so much literature and so much more information that's out there in our, for injury prevention, especially with overhead athletes. It just amazes me still how it hasn't percolated downward, because we're trying to get the word out. I mean, we have all these programs, we have all these announcements and public service announcements, but it seems like it's still not getting down to the youth leagues.
I think that some of it has to do with time. So everybody's busy. They have practice time. They have an allotted, small amount of time to do the things that they want to do from a coaching standpoint. And I think sometimes taking up that time with somebody coming in for, trying to do preventive things might not fit in with how they're running practice. If we look at, high school baseball, they fit a ton of games in a short period of time because we're in the Northeast, right? In particular, we have rain, we have snow. I mean, this season's probably not been great for the start. They have to crunch games into a couple of weeks before the end of the school year, and so I think that often comes into play. How much time people have.
So, what's the answer? I mean, what is the answer? Is the answer the individual athlete and the individual family has to take that responsibility on their own, and then what do they do? Like, what's the answer?
Well, I think the answer is multifold. I think that we have to put the onus on everyone. The family needs to be involved, and they need to be educated on how to manage things. I think the coaches need to be involved, because if we look at sports performance, the ultimate sports performance is making sure that people don't get injured. Because if you have a kid who's injured, he's not going to play for you. So you have zero performance. So I think it goes into a ton of different directions. I think people who are on the provider side, PTs, physicians. I think sometimes they need to be more educated on some of this stuff. Because
no doubt.
Not everybody is involved with sports as we have been, but they end up seeing athletes.
Right.
So I think education across the board probably needs to be better. Even if it's out there, how do you deliver it? I mean, this is a good format to deliver it. I know that from physical therapy at St. Luke's, we try to get in the community and do some community talks. I think that can be effective.
No doubt.
I think there's a lot of things that can be done.
And for those of the folks watching today, certainly going to sportsinjuries.org is really where STOP is situated, and there's a lot of information there. Also, the American Baseball Medical Society website is there. But one of the things that kills me, and it happens probably at least once a year, if not twice, is I see a 13-year-old with truly a career-ending injury.
Sure.
Whether it be an elbow, a problem with their growth plate, a problem with, the problem they slough off cartilage. There's different things, and that's the one that you want to scream when you see them. So I want to divide things up a little bit, for the parents out there that are listening. And I want to talk about some of your recommendations, some of your thoughts on, let's talk about the early starters, the 6 to 8 to 9-year-old, 10-year-old kids that are out there. I mean, one of the things that I try to emphasize at that age, first of all, specializing in one sport, I think, is a big mistake. And it's not that I just think it's a bad mistake. We've proven in the literature it's a bad mistake. And there's several of there are several great recent studies that big populations that not only show that that playing multiple sports can help prevent certain overuse injuries and certain injuries in general, but also those that make it into higher levels, college, and even the pros. Many played multiple sports until they were in their at least early teens, if not mid-teens.
Well, I don't know if you saw this, but it's not a baseball coach, but Urban Meyer had on his whiteboard. Did you ever see that?
Yes.
So he had a list of players that he was recruiting. One list that had probably 30 guys on it said multi-sport athletes. There was another list that had 3 guys that said football players.
Exactly.
So that tells you right now that people in major college sports, they're looking for an athlete that they can then take and make a better athlete and fit into what they want it to fit in.
No doubt. And there's certain skills, again, I understand, certain skills. Tennis has certain skills. The throwers have certain skills. Fielders have certain skills. Soccer has certain skills. But what you can get by cross training and cross, being involved with, a basketball player playing, playing soccer, or a football player playing lacrosse, or a basketball player, running track.
Sure.
All those things that brings different body movements into the picture, and I think that helps. But especially in youth sports, one of the things that I really don't like is that, here you have a group of kids that are making a decision of what they're doing before they're mature enough mentally, but certainly before they're mature enough physically. You don't know what kind of body type these guys are.
The other thing is that they might be missing out. They might be missing out. You might have a kid. I've had 12-year-olds come in and tell me I'm a baseball player. And I'm like, no, you're a 12-year-old.
Exactly.
And, you should explore some other things, because maybe that baseball player could have been a great lacrosse player, or a quarterback, or something else that they're missing by saying I'm only a baseball player, I'm going to play year round, and that's that.
All right, so you have a patient or your family member, which usually happens. They call on you. You're the medical professional. You're the guy that's the expert, and they have a 7 or 8 year old that's on a travel team, already. But one of the things I'm interested in is, like, okay, you're talking to them. You could tell them anything. You tell them anything right now, and you could look at their kid and evaluate their kid, even at that age. Say, like I said, the 7 to 9, 10-year-old. What are you looking for? What are you talking to them about?
Well, I think that you're talking to them about being informed on the potential. If we're looking at a baseball player, like, make sure they know. If the league has pitch counts, well, you need to qualify that a little bit.
In a big way.
Talking earlier, some leagues do pitch counts, some do inning counts. Not all pitch counts and inning counts are created equal, and that's an educational thing. I've had conversations with people, and they'll say, well, they can only go 3 innings. Well, what if a guy throws 10 pitches over 3 innings? Well, he's playing great. And that's a little stress.
Right.
But what if he throws 40 pitches an inning?
60.
Right. So,
Exactly.
and he's going 3 innings.
Exactly.
You could have a very young kid throwing
right.
a lot of pitches, and that really could damage him. And I would caution people to take hold of their kid, and they need to make decisions. So, they're relying on coaches, and the coaches counting the pitches. And I think they should be counting the pitches themselves.
No doubt, and get a clicker and start counting. The other thing is, a lot of these kids play in multiple leagues, or they have professional coaches, right, even at that time. So, or they're pitching batting practice. They're
Sure.
the ones pitching batting practice.
Right.
If the coaches, the 45-year-old coach's arm goes out after,
Sure. Right.
So, all those things count. All those things come in. Now, talk about a little bit about the preparation of what do you see as necessary preparations of a kid's conditioning, balance, those kind of things. Just those little things that you could look at, you could show the parent and go, look, this needs help.
Sure.
This needs something from the bottom up. We talk about a kinetic chain. We've talked about a kinetic chain for years.
Right.
And what that is, what is the energy that's created in the whole throwing movement from the toe to the last fingertip touch of the ball.
And I think that probably applies to every sport.
No doubt.
Chain everywhere. And I think that people look at arm and they look at upper body. They often forget about the legs. I think that as kids are growing, the thing we need to look at is what's their flexibility look like. And I think anytime somebody has a growth spurt, and I see this, I see kids that have come in that
Absolutely.
have injuries related to growth spurt. So their long bones are growing, their muscles can't keep up, so they get tighter. The other thing is that their strength can't keep up. So that you have muscles through the hip girdle, the glutes, your lateral glutes that are just not, the strength is the same, and now they're asked to move a long bone. It's longer than it was last year, and they're ending up with overuse injury.
No doubt. And one of the things I say is that their technique sometimes is so good and so in the slot, if you look at a adult, that their body's not built to handle the stress
Sure.
of the range motion. We're talking about when you just rotate your arm like this down. We're talking in the youth leagues, 3,000 degrees a second.
Sure.
As you get older, the professional goes about 7,000 degrees a second.
Very violent
So
movement.
think about those shear forces. We're not just talking in the kids. We're not talking about the ligaments. We're talking about the growth areas on the bone.
Right.
We call the epiphysis, or the growth plate. And you're talking about some of these kids. Their technique is so good that the torques that they could put on their body is they're not quite ready for it. One of the things I check first, and it's one of the things it's one of the ways, and this again is all athletes, like you said, across the board, whether it's a knee injury, whether it's a shoulder injury, whether it's a back injury. I have them stand on one leg on a balance pad. Yep. And first of all, a lot of adults can't do that, which I find is a problem too. But when that starts the whole foundation of any movement you're doing, whether it be basketball, baseball, football, lacrosse, soccer, is balance. Athletic position. Remember, coaches yelling at you about get down in your athletic position, all that kind of stuff, and get your cores. But they never really explained it. I think we have words and explanations that we could talk to the parents a little bit more. Why don't you talk a little bit about that? Yeah,
and I think that going back to what you said about every sport, at some point you're on one leg.
Right.
It doesn't matter what sport you play. Tennis serve, you're throwing a baseball, you're pitching, a quarterback. I mean, you're going to be on
across,
one foot.
Absolutely.
We're incorporating some of that now into rehab. So if we're incorporating into rehab, it's probably an important part to incorporate in the prehab.
Right.
So you're catching those things before they happen. If you don't have a solid base to push off of in your legs because your balance is off, or your strength is not there, or your flexibility is not there, you're going to transfer that lack of stability through the rest of your body, and that's when we see shoulder and elbow injuries in a baseball player or any kind of overhead athlete.
You used a great word that I didn't want to skip over. Prehab. It's like one of my favorite words in the world, because that's using conditioning to prevent injuries, and it's, before you need rehab of an injury,
right,
you're prehabbing a condition, and that is so important. And that's why, again, a couple things I usually recommend in youth sports. One is taking at least a season off of no matter what you do.
Right.
Okay? You need recovery. All these kids need recovery. It doesn't mean they're sitting on the couch playing Nintendo. It means they're maybe doing different movement activities, and maybe doing just calisthenics. I mean, I think there's a big problem that kids forget how to do that now.
Oh yeah. Going to that though is that you get kids, and I really like this, that they might be a really higher level, let's say baseball player, but they play rec league basketball.
Exactly.
I think that's your rest. Because it's not super competitive.
Right.
They're practicing maybe once a week, twice a week. And playing in games,
and they're having fun.
Right, that's missing in youth sports.
They're having fun. The pressure is not there.
You asked me what I would tell an 8, 9, 10-year-old.
Right.
I would say make sure your kid is having fun.
Correct.
While they're playing, and if they're not having fun in the sport that they're doing, we need to find something that they have fun with, because that's why at age 13 they're not in organized sports anymore, because they didn't have fun when they were 6, 7, 8 years old.
And we're talking. There's one of the things I like about Little League baseball as an organization. We're talking about the actual organization, and people love it or hate it. It's an organization like any others, but people have resisted, I guess, stepping into line with what they believe in. But one of the things they do very well is protect the athlete. That's one of the things they're very big on. And if I always tell the parents, go to the Little League baseball, littleleague.org website, and there's really specific, the pitch counts for all different levels, whether from 7 to 10, from 10 to 13, from 15 and on. The problem with those ages, as you as I know, I mean, you have the kid, you're right in it right now.
Right.
You could have a kid that's 12 years old and he's shaving.
Right. Yeah.
And he's the stud of the baseball team.
Right.
But he's done because he's done growing. Or you could have a kid that looks like a 7-year-old.
Sure.
And so even then we got to be a little bit careful about those pitch counts and such. Let's go to a little older now. And our kids entering middle school. And do you see a difference in like what you can allow them to do and what you can train them with at that point, and what's your criteria for that?
So I think the biggest thing between those really younger kids and then those in the step up in the middle school is coordination. So it's more difficult to teach the younger kids different movements, and I often am looking for an increase in strength anywhere. Mm-hmm. So do they do it exactly right? Maybe not, but it's good enough because they're going to increase their strength.
Right.
When you get up into some of the older kids, the coordination's better. They can get their shoulder blade in the right spot. They get their arm in a better spot, and you can teach them. Their attention's a little bit better. Their focus on what they're trying to accomplish. So I think it makes it a little easier for us. But it makes it, you have to be more specific because again, the forces that they're putting on their body are more because they're bigger, they're stronger. So that's why you need to be a little bit more specific on how you train them.
And it really takes for them to kick into puberty, for the hormones to be there. Ultimately in the pediatric population, you can do some strength work. And when you do that strength work in that population, you're teaching the muscles that are available to be more efficient in their movement. You're really not looking for bulk. You're not going to get, a jacked out kid or anything like that because they don't have the hormones to do that. You want them to move as efficiently and generate as much power through the muscle tissue that they have, and really learn how to be strong, learn how to do some lifting and strengthening activities. So I'm all for that. Once they get into puberty, then you could expect difference in body,
some hypertrophy of muscles and things like that. But I think more important than that, particularly with overhead athletes, is we're looking at trying to make a neuromuscular change. So not only are we training what is weak, we're making it strong. And I often see people, and I can make a change in strength even like the first visit, but I'm not really changing strength. I'm making their brain fire the correct muscle, and now all of a sudden they're stronger. And it happens immediately. This
is something I really wanted to get into because this is your expertise. I've always said is this, and you have a lot. But I mean, in particular, one of your great expertise is, evaluation of the athlete coming in with pain, and particularly in the throwing athlete, the evaluation. Person comes in. We always said, person coming with elbow pain, look higher up.
Right.
And
that goes to the old adage of he who treats the site of pain is lost.
Yes, perfect.
So if it hurts here and I treat here, I'm probably not going to get it better. But.
So explain that. Explain to somebody who no exposure to this.
Sure.
Kid comes in, baseball player, tennis player, athlete, but is an overhead athlete. What are you looking for?
Well, so you're looking for a number of different things. First, I'm looking for static posture. Static posture is important because it tells me where their joints are sitting, where their resting position of ligaments, muscles, and it gives me a little bit of a predictor how they're going to move when I look at them dynamically. I then look at how then I'll go into, after I look at that static posture, how they move, and I'll assess, does the right side move the same as the left side? Because that's a big piece. And then I also have to think, is the unaffected side, so if they come in with right shoulder pain and I'm looking at the left, is that moving properly?
Correct.
Versus the hundreds or thousands of kids I've seen before, because sometimes you'll get them on both sides, like a swimmer.
Right.
And they're both moving funky. One's moving one way, the other shoulder blade's moving another way, and you have to assess, do they have a normal side?
One of the expressions I use in my office a lot is Shaggy syndrome. You remember Shaggy from Scooby-Doo?
Yeah.
Shoulders like this.
You're right.
I'd
see it on the prescription. I give
it to you. Yeah. So I said Shaggy syndrome because I think it's almost cultural now. That kid's slumped.
Well, it's video games.
Video
you're on your phone.
Yeah, no doubt.
You're
everything's forward.
Right.
But then, particularly in swimmers, I see, that's their, and gymnasts, I see a lot in.
Sure.
That their posture is, because all the power is forward.
Yes,
all the power is forward.
Itself to their sport.
No doubt. So it's important to develop those muscles. I'm not saying there's not. But what is lost is the balance of those muscles to avoid injury.
Right, and to the posterior muscles.
Correct.
And I'm big on the shoulder blade and scapular mechanics and how that's moving. So that's a big piece that I look at with an upper extremity athlete.
Well, let's talk about that. Let's talk about specifically, because I'm one of those believers that the scapula is often the root of most evils.
Right. Yeah.
Okay. I'm going to bring up Stymie. Hold on. Here's Stymie. Okay. He's our little friend, And so go ahead, talk about what you're usually talking about.
So, typically when we see that forward shoulder posture, I'm also seeing tightness in the upper trap, which is the muscle that runs from the top of the shoulder blade up into the neck, and weakness down low in the scapula. So you can think of this, it's like a mud flap on a tire, on a big truck. So if you're holding it and anchoring it up here, this bottom piece is flapping down here.
Right.
What we need to do is we need to get more stabilization down lower onto the scapula so that you stabilize this. With what we want to try to do is with dynamic movement, bring it back into this position.
Well, what's interesting, and that's a great point because you always make that point. Okay, so you have the scapula down like this, and you've always talked about, well, what's happening with that? Why can't they overhead throw? So is this outlet right here?
Right. So you have the rotator cuff tendon, your supraspinatus runs through here, bursa sac. There's a number of structures, and it's not a very big space. I mean, this is probably bigger right now that I'm holding it than it is in real life.
Multidirectional stability.
Right, and then and then you bring this more forward and you close down on that space. So if we open up by posteriorly rotating that scapula,
you do this. I've seen it. You stand behind a patient. I'll do it for you. You kind of put your hand here and you do this.
And now all of a sudden the space is there.
And they have no pain.
Right.
I've seen that. That's one of my favorite things that you do.
It's my favorite test is doing that scapular relocation without even the manual translation, and somebody's weak. So they're in this bad postural position. I'll have them hold their arm out and push it right down.
That's right.
Then I reset them and say, squeeze back here, because they have the ability. They're neurologically intact.
Right.
So there's no weakness or reason why they can't do it. They bring their shoulder blade back, and then all of a sudden the strength comes back. Well, that gets you buy-in. I mean, for me, they know that now, okay, this guy can probably fix my problem because he just made me stronger in one movement here.
Exactly.
Now, the key is to then train this so it happens automatically.
Right.
You can't think about bringing the shoulder blades back while you're throwing or while you're serving a volleyball or swinging a tennis racket. It has to come automatically. So that is where the repetition comes in.
Plus, I mean, by the time they see a lot when they're forward, so many of the anterior structures like the pec minor, those structures, the scaling, are so tight that they're doing this and they're miserable at first.
Oh, yeah, absolutely.
I mean, and I tell them all,
it pulls in the front.
Right.
Yeah, and I'm fine with that. I said, I just don't want you to have pain in the front.
Right.
It pulls in the front is fine.
Exactly. Yeah. Exactly. So that is one of my, that's one of the key to, the shoulder, is the stabilization here. But it's also the key to the actual shoulder joint itself and the elbow and everything up of the upper extremity. It's the foundation where you throw off of.
One of the interesting things that I've seen is there is often a paradigm shift between the scapular muscles and the rotator cuff muscles, and you see tenderness and tightness in through the infraspinatus and teres minor, because that is providing stability, because they're not getting stability medially inside here, and so then you get tightness leading to some tightness through the shoulder. Might see internal external rotation tightness because these guys are working so hard to stabilize. And so what happens is you strengthen back here, it releases that tension here, and then you have freer movement. So sometimes, I mean, I've had people lately that I don't even stretch any kind of rotations anymore, because I want to see what strengthening does. So you no longer have compensation.
Right.
The mechanics have been restored inside the shoulder complex, and then all of a sudden everything resolves. And
you're not worried about static stability. You want them to be able to get it dynamically.
Right, that dynamic
to use their muscles to get that back to where it belongs. And I think that's just a key to a lot of the problems that are going on in the shoulder.
Sure.
So the other thing I wanted to talk to you about very, very, specifically is what is your feeling on any pain in the youth athlete? Any pain? We often say, I'm fortunate enough to take care of professional baseball players and throwers, and it would be unusual for a pitcher not to be sore the next day.
Right.
Okay.
Right.
It'd be unusual. I mean, that's why. I mean, what's the first thing you do when they come out of the game? They're packed in ice. Their elbows in ice. Their shoulders in ice. You control the inflammation. And for them to tell you, I'm a little sore. You're not going to pitch the next day. You're going to go through all the treatment modalities. Their trainers and physical therapists are all over them, and so that's okay. What's your feeling when it comes to a child in pain?
I don't think anybody should have pain, and that's one of the hardest things I think we do is try to have them differentiate between soreness and pain. But I think once that's established, you really can't have pain. I've run into some teams who think there's a group of them, 5, 6 guys, and they're like, oh yeah, we have pain all the time. It's normal. Pain is not normal. And I recently have said, try to categorize it. If you do activity after you have this, whatever you want to call it, pain or discomfort, because you can't differentiate, and it feels better after you've done activity, it was probably soreness.
Right.
If you do activity after you've had that pain or soreness and it hurts more, it was pain and you need to back off. So, I mean, to give like 2 simple things, if you go and do more, and so you pitch that day, and then the next day you wake up, if you go to move and exercise and do something and it feels better, it was probably just soreness. If it continues to bother you, it was pain, and we need to address that.
Exactly. And you hate by the time they come to see you, they're having pain with activities of daily living. Just life. It's one thing, they get some soreness, and I don't even think this is correct, but it's early on if they're getting soreness after an activity, a little worse during the activity, and if they're having soreness outside of that activity, it's already a problem.
Oh yeah.
And if we talk about anything today and we get any word out there, it's like that it ain't normal.
Right.
And no coach to tell you it's normal, no parents to say I just toughen through it. It's really the onus is on everybody listening to that athlete.
Right.
And you know what? There was a great study, and everybody's mentor, Dr. Jimmy Andrews down in Alabama and Florida, had a great study about youth sports. And it was like, until you asked the child, are you having pain? They didn't admit to it.
Sure.
Just like any, that's part of the athletic mentality, okay? And it's part of the society that we've developed, fortunately or unfortunately. And one of the things you have to do is ask that athlete, how you doing?
Yeah, it's probably good after a game. Like, how do you feel?
Absolutely.
How did you feel when you throw? How did you feel
Absolutely.
when you ran? And I think they don't want to lose their spot. That's why they don't say that. I think part of the problem with youth sports now is that every practice is so intense because they don't want to lose a spot.
Right.
They have kids. It's almost game. Like game time intensity.
Correct.
Every practice.
Right.
So it's not the volume. Like you talk to some of the old timers and Nolan Ryan and Steve Carlton and those guys threw all the time and didn't have any problems. It's because they had fun. They got in a sandlot. They might have thrown around with their friends. They didn't have these intense practices every single day. And then when it came time to play, they didn't have injuries.
They're worn out.
Right.
Yeah,
now they're worn out.
Worn out.
Now they are. They're worn
Right.
out. They're slinging the ball around too hard. And we probably just need to pump the brakes on the intensity, make it fun, make practice fun, and then the games will probably go better.
Right, and that's the purpose of today is to get the word out. Let's let the kids have fun.
Yeah.
Let's get them involved in multiple sports. Let's keep them fit. If anything else, the importance to our society of a fit population, especially a fit youth population, so they don't become unfit adults, is so important.
Childhood obesity is at an all-time
high.
And so
all-time
more
high.
Participation in sports because you make it fun, I think, is important. Like I coach some youth sports. I coach flag football, and I have parents that frequently come back and they want me to coach their kid because I try to teach them something. I try to keep it fun. I mean, it would be great if we won. I want their performance to be as best as it can possibly be.
No doubt.
But if they really, the only thing that I preach is I want their intensity to be high when we play.
Right.
I don't want to, like when you go out and play, you play hard. If we lose and you played hard, then I'm fine.
Those are life lessons. That's why I love sports, and that's why I've been involved with sports my entire career, because that is the life lesson. What I'd like to see, though, is that we don't burn our kids out.
Right.
They're lifelong athletes and fitness participants, and that we get this under control.
Sure.
So, Howie, man, thank you for coming on today. Again, Howie Knudson from St. Luke's Physical Therapy, one of the best, and I'm sure we'll have you on again in the future.
That'd be great.
And so I appreciate it. And remember, it's Youth Sports Safety Month. April is Youth Sports Safety Month. If you have any questions, you can look up on the web or go to STOP, the organization for sports trauma and overuse overuse foundation. No, that can't be right. No, I'm going to try it again. It's sports trauma and overuse prevention. I got that. And because I think it's so important to keep our kids healthy, to keep them going, but to protect them from injury. So thanks. This is my name is Dr. Rob Palumbo from OAA Orthopedic Specialist, presenting for the OAA Sports Foundation. Thank you very much for listening, and we'll be back sometime. Give us comments. I would love to see your comments from either YouTube or from our Facebook pages, and let us know what we could do better. Let us know what you want to hear about, and we'll see you next time. Thank you.